Welcome to DHEC's role in emergency operations and orientation. The purpose of this course is to familiarize you with our agency's roles and responsibilities in emergency management and with your individual role as a DHEC employee. DHEC policy requires all employees to complete this basic orientation so you will be able to support the overall DHEC emergency management program. If you have a direct or primary role in emergency response efforts, you will receive additional specialized training as outlined in the DHEC Administrative Policy Manual. As a DHEC employee, you have a very important role to play during a disaster in South Carolina. No matter what your job is, during a disaster you might be called upon to serve in a capacity unrelated to your regular job duties. At the end of this orientation, you'll be able to identify the 2 emergency support functions for which DHEC is the lead agency and has primary responsibility. Identify at least 2 of the emergency support functions for which DHEC is a support agency. Describe how your regular job duties might change in an emergency and the steps you need to take to be prepared. And prepare an emergency plan and emergency kit for you and your family. As the public health agency for the state of South Carolina, DHEC's mission is to promote and protect the health of the public and the environment. Every day, DHEC works to prevent epidemics and the spread of disease, prevent injuries, assure the quality and accessibility of health services, protect against environmental hazards, promote and encourage healthy behaviors, respond in disasters and assist communities in recovery. During a disaster, our routine roles and the emergency functions assigned to the agency are vital to an effective response and recovery for the state. To understand DHEC's role in emergency operations, it's important to understand the potential risks facing the state. South Carolina is the 26th most populous state in the nation. It also boasts a large tourist population every year. Therefore, any disaster has the potential to cause a catastrophic loss of life and property. Each South Carolina county and municipality faces a unique combination of natural, man-made, and social hazards that could harm specific areas or damage important community services. Historically, the greatest risks to South Carolina have been from natural hazards, but the increased use of chemicals and the transportation of hazardous materials pose additional risks to the residents of our state. Moreover, South Carolina has 4 nuclear power facilities with 3 more located in neighboring states. All but 5 South Carolina counties fall within the 10 to 50-mile emergency planning zones of at least 1 nuclear power plant. South Carolina experiences several low-level earthquakes annually, and 25% of the state's population lives within a mile of a rail system, placing them at greater risk from hazardous material spills. While there have not been any successful acts of terrorism committed in South Carolina, the state has many critical and high-profile facilities, a high concentration of population, and other potentially attractive targets for terrorist activity. Terrorist attacks might involve the use of hazardous materials to injure or kill, the use of biological weapons that could cause disease, or other means of destruction. Infectious diseases can present special requirements for disease surveillance, rapid delivery of vaccines, antibiotics, or other drugs, and expansion of healthcare services to meet a surge in demand for care. Certain communicable diseases have the potential to spread among the population and cause illness and death in such large numbers that the current medical system could be overwhelmed. How does the state prepare for such emergencies? The South Carolina Emergency Management Division, or SCEMD, is the lead state agency for emergency management and is responsible for the State Emergency Operations Plan. This plan assigns responsibilities to agencies, outlines policies and procedures, and provides guidelines for emergency response. DHEC, like all state agencies, is responsible for particular emergency services and has a comprehensive and coordinated agency plan that is integrated into the state plan. The roles across the different levels of emergency operations can be represented as a pyramid to learn how the National Emergency Management System is built on shared layers of responsibility. Citizens of South Carolina form the base of the structure. At this level, you have a responsibility to protect yourself and your family by knowing what to do before, during, and after a disaster. At the local level, county emergency management staff and DHEC regional offices work together to manage incidents and coordinate activities within each county. If support and resources are needed beyond what the local level can provide, the local community can request assistance from the state. At the state level, South Carolina Emergency Management Division, the state's lead agency in emergency management, coordinates state-level activities through the State Emergency Operations Center. DHEC and other state agencies staff the State Emergency Operations Center during an incident. The state provides additional resources, such as money, equipment, and personnel, to close the gap between what is needed and what is available at the local level. At the top level of the pyramid is the Federal Emergency Management Agency, called FEMA, which provides resources to help state and local efforts. Other federal agencies respond as needed, and other federal resources can be brought in from states not affected by the disaster. State and volunteer agencies are grouped by their capability into Emergency Support Functions, or ESFs. These groupings organize different emergency functions to ensure the most effective response and the most efficient use of personnel and resources. Each ESF has one agency serving as the primary agency and several agencies providing support. Here is a list of all emergency support functions. These are critical areas that may be needed in an emergency. This system provides an orderly structure for identifying what has to be done and what agency has a primary role or a support role. DHEC has primary responsibility for two of these emergency roles. Health and Medical Services is ESF 8, and Hazardous Materials is ESF 10. DHEC also has support responsibility in 8 other ESF areas. Next, we'll look at DHEC's primary roles in more detail. Although DHEC has the primary responsibility for health and medical services within ESF 8, there are more than 20 support agencies that have specific roles in the activities under health and medical services. Medical care includes provision or coordination of doctors, nurses, technicians, and licensed ambulance services, assistance with the coordination of patient relocation, and the establishment of emergency medical care centers. Public health and sanitation includes development and monitoring of health information, inspection and control of sanitation measures, inspection of individual and public water supplies, monitoring and control of disease, immunizations, and laboratory testing. Behavioral health functions include management of crisis counseling and psychological first aid to address mental health and substance abuse problems caused or aggravated by the disaster. Identification of the deceased and mortuary services include the location of facilities and supplies for handling the deceased. The Strategic National Stockpile is a massive repository of drugs, vaccines, medical supplies, equipment, and other items for use during a disaster. DHEC is responsible for the coordination of the Strategic National Stockpile Program for the state of South Carolina. DHEC also has the primary role for the Hazardous Materials Emergency Support Function, which includes radiological and chemical substances. Hazardous materials cause damage to the environment and the public. although DHEC has the primary role for hazardous materials, there are over 10 other state agencies with a support role in handling hazardous materials. Hazardous releases might come from industrial plants, nuclear facilities, hazardous waste treatment facilities, transportation of hazardous materials, abandonment of hazardous waste, or damage during a natural disaster. DHEC works closely with the responsible parties in the cleanup and removal of hazardous materials. DHEC provides personnel, equipment, and technical expertise to detect and identify the hazardous materials, assess the threat to the public's health and safety, contain, remove, and dispose of hazardous materials, and decontaminate and remediate the environment to protect public health. Let's review. On the next screen, you will be asked a review question. Let's see if you can get it right. Don't worry, you can try as many times as you like. Click the Next button to continue. DHEC serves a primary support role in 2 emergency support functions. From the list below, select the 2 emergency support functions for which DHEC serves in a primary support role. That's right. DHEC's primary roles in an emergency are health and medical functions and hazardous materials functions. DHEC has support roles for the emergency support functions listed on the blue tabs to the left. This means that another agency has the primary responsibility, but DHEC provides help in these areas. Let's look at DHEC's support functions. During a disaster, DHEC has a support role in public works and engineering. DHEC employees offer guidance and technical support to maintain safe water, sewage disposal, water and sewage plants, and the disposal of hazardous and household waste, as well as animal carcasses. In the event of flooding or potential dam failures, DHEC organizes an advisory team to assess the situation and provide information to emergency managers. This information can help the Highway Patrol and others redirect traffic and ensure public safety. DHEC helps with mass care for the public, which includes counseling, health care, oversight of food and water quality, as well as providing staff to assist with these duties. That can include opening special medical needs shelters and providing the nursing staff needed to oversee patient care as well as medical supplies. When a disaster occurs, ambulances can be dispatched centrally by the DHEC Division of Emergency Management Services and Trauma to support search and rescue operations. DHEC's Environmental Quality Control, or EQC, provides technical assistance with detection, monitoring, and safe management of any hazardous materials encountered by search and rescue teams. DHEC's EQC plans for and provides technical assistance for contaminated debris management and removal in addition to environmental cleanup. DHEC's Office of Ocean and Coastal Resource Management, or OCRM, determines if damaged structures located on the beachfront can be rebuilt or must be relocated in accordance with state coastal management regulations. Public information officers from DHEC update the public during emergencies with correct and timely information at joint information centers at state and local levels. DHEC works with Clemson Livestock and Poultry Health and the Clemson Plant and Pesticide Lab to provide public health guidance and consultation on animal issues which impact human or animal health. The Medical Reserve Corps registers and identifies volunteers, healthcare workers, and resources prior to a disaster so the assignment of health and behavioral volunteers can be coordinated when needed. Let's review. On the next screen, you will be asked another review question, this time about DHEC's secondary roles in certain emergency support functions. Let's see if you can get it right. Don't worry, you can try as many times as you like. Click the Next button to continue. DHEC serves a secondary support role for 8 emergency support functions. 2 of these emergency support functions are included below. Put a check mark in the box next to each of these two emergency support functions, and then click Submit. That's right. Among the 8 emergency support functions for which DHEC serves a secondary role are Mass Care, ESF 6, and Public Information, ESF 15. What is your role as a DHEC employee during a disaster? Every DHEC staff member is expected to function in a support role in a disaster. You may also be in a position that will require you to work in a primary response role. If so, you will receive additional specialized training. But what does that mean? During a disaster, one or more changes to your job may occur. These are all temporary changes in response to the emergency or disaster. But keep in mind, in an emergency, you will not be asked to do anything that you cannot do or that you are not trained to do. Talk with your supervisor about your role in an emergency. Ask if there is any additional training that you will need, and prepare your own personal or family emergency plan, your emergency kit, and supplies. When a disaster occurs, you might not have much time to respond, so it's important that you and your family are prepared and know what to do. By taking the time to develop a family emergency plan and assemble a family emergency kit, you can help keep your family safe. Here are some things to consider when preparing a family emergency plan. For now, take a moment to review this list. An emergency supply kit will make you and your family more prepared for whatever disaster might occur. Make a list of items that would be necessary for you and your family's personal comfort and safety. Look at the following list of suggestions. Important information to help you plan and prepare for disasters is available on the web. This completes the orientation to DHEC's role in emergency operations. We hope this has helped you become more familiar with the agency's role and your role in an emergency as a DHEC employee. If you have questions, please speak with your supervisor or call the numbers on this screen.